There's growing evidence that AI is becoming an initial filter in healthcare-seeking behavior, fundamentally changing how people decide whether and when to seek medical care. This shift has both potential benefits and serious risks. The potential benefit is reduction of unnecessary appointments for truly minor issues. Someone with a mild cold who might have previously scheduled a doctor visit for reassurance can instead use AI to confirm that their symptoms are consistent with a common cold that requires only rest and fluids. This frees up appointment slots for people with more serious needs and reduces burden on overtaxed primary care systems. However, the flip side is delay of urgent care. When people use AI as a first stop, they may receive reassurance about symptoms that actually require prompt medical attention. The delay between symptom onset and medical evaluation can be clinically significant. For heart attacks, strokes, and many other conditions, every minute matters. If someone experiencing early heart attack symptoms consults AI first, gets told it's probably indigestion or anxiety, and waits several more hours before reconsidering, that delay can result in permanent damage or death. The change in health-seeking behavior is subtle but profound. Previously, people might have erred on the side of caution, seeing doctors for things that seemed concerning. Now, AI provides a reason to not seek care. If the AI says it's probably fine, that's enough justification to avoid the expense, time, and hassle of a medical appointment. The threshold for seeking care shifts upward. This might be appropriate for some people who were previously overutilizing medical services, but it's dangerous for others who should be seeking care but don't because AI provided false reassurance. Design interventions can nudge users toward appropriate levels of care, but they require thoughtful implementation. Systems should be biased toward recommending evaluation rather than reassurance when there's any uncertainty. Instead of saying this is probably nothing serious, they should say these symptoms could indicate several conditions, some of which require medical evaluation, so you should see a doctor if symptoms persist or worsen. The language should emphasize the limitations of AI assessment and the importance of professional evaluation for anything concerning. Integration into clinical intake processes could help. When patients arrive at appointments, intake forms or medical assistants could ask whether they consulted AI about their symptoms and what information they received. This allows doctors to understand the patient's prior information and decision path. If AI gave reassurance that delayed care seeking, the doctor can explain why that was problematic. If AI provided helpful information that educated the patient, the doctor can build on that foundation. This transparency helps doctors understand patient behavior rather than being mystified by why someone delayed seeking care or why they have specific preconceptions about their condition. The fundamental question is whether AI as a first stop is sustainable given its limitations. If people increasingly rely on AI for initial health triage, we're collectively trusting a tool that cannot perform physical examinations, cannot run diagnostic tests, has no legal or professional accountability, and is known to sometimes provide incorrect information. This seems like a dangerous population-level shift. The counterargument is that the current system is so broken, so expensive, so inaccessible, so time-consuming. That imperfect AI triage is still better than the alternative of people making uninformed decisions or avoiding care entirely due to cost and access barriers.